This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
A dilemma is a situation in which one needs to
Paano ako gagaling?
An ethical issue as opposed to
second.
health first.
Medical Dilemma.
Hi everyone, I'm Attorney Sarah Jane Sugitan. Welcome to Medical Dilemma. Today we're going to talk about female infertility, and joining us on the show is a very special guest, Dr. Aileen M. Manalo, who is an OB-gynecologist, a reproductive endocrinology and infertility specialist, and also past president of the Philippine Society of Reproductive Endocrinology and Infertility, and an active consultant of Makati Medical Center, Asian Hospital and Medical Center, St. Luke's Medical Center, and a professor at the Department of OB-GYN of the UP-PGH. Welcome to the show, Dr. Manalo.
Thank you, Sarah.
Yes, today we're going to talk about female infertility, of which you specialize, Doctora. Can we define female infertility or pagkabaog?
Okay. Siguro fertility in general.
Yes, okay.
So infertility is the inability for a couple to achieve pregnancy after trying for 1 year. So it's unprotected intercourse for 1 year. That's regular intercourse. We can't define regular intercourse. I mean, could be
It
2
doesn't have
to
to
3
be
times.
daily.
Oh, no, it has to be syempre between husband and wife, diba?
Yes,
So it's inability to achieve pregnancy within 1 year.
Okay, so Doctora, infertility or pagkabaog, it affects not only...
Hindi siya pagkabaog eh.
Okay.
Pagkabaog is sterility. So,
Sterility.
pag
Okay,
sinabong
so that's
baog, talaga
different.
hindi magbubuntis yun. No? Pero ang infertility is just that they're having a difficult time achieving pregnancy.
achieving pregnancy. So
So I
it's
think we should-
medically speaking, it's different. So
Yeah, at saka we should really take away the stigma from calling people baog.
baog.
Diba?
Yeah, there's a negative
Oo,
connotation.
oo,
That's
right,
true.
right, oo.
But when you discuss infertility or when you say infertility, it means that there is still a chance or there's still a way
Right,
for the couple
right, oo.
to reproduce or
Correct, to
yes,
be able to achieve a pregnancy.
pregnancy.
Oo, oo.
Ngayon, Doctora, what causes female infertility?
Okay. Well, there's female and male nga, di ba? So, female infertility, kadalasan yung hindi nag-ovulate. So, they don't release the egg on a monthly basis, okay? And then there's pelvic factors. Pwedeng fallopian tubes are blocked, or there could be endometriosis. There could be some problem with the uterus, some blockade, like myomas, yan. So, in about 10%, there's no known cause. But, you know, there's female and then there's the male part. So, half actually is female, causes female, the half is male. So, yung isa naman, ang problema, yung similya, hindi maganda ang count, mababa yung count, hindi siya magalaw yung similya, o kaya hindi normal yung morphology, yung anatomy of the sperm cell itself.
Let's discuss yung sinabi niyo, Doctora, that the egg hindi nag-ovulate. Tama po ba? That's a cause of infertility.
Anovulation. So, most commonly is
Anovulation.
polycystic ovary syndrome. So, we see that in about mga 5 to 10% of women all over the world. In the Philippines, very common.
It's very common, surprisingly. And we have here, Doctora, yan, here. Habawa, abnormalities, for example. Maybe you can
So
discuss.
ito, tinan mo to. This is a blocked fallopian tube. First of all, let's try to see how a woman
Okay.
can get pregnant muna, di ba? Okay. So ito yung uterus. So this is the uterus. Pag nag-contact, halimbawa, on a monthly basis, di ba, you're supposed to release the egg.
Yes.
So the egg is released from the ovary. It's picked up by the fallopian tube here. So pag nag-contact ang mag-asawa, at the time that you're about to release your egg, then the sperm will go up, swim up here to the uterus, and then pass through the fallopian tubes and reach the area where the egg is. So millions of sperms here, and then kumukonti yan, papanik siya dito. You only need 1 million sperms here, and you only need 1 sperm to be able to fertilize that egg. So once that egg is fertilized, now that fertilized ovum now will traverse the anches of fallopian tube, and that will take about a week, and then it will go back to the uterus where it will implant in the endometrium, no, sa uterine cavity.
So that's how you that's
How you achieve a pregnancy. So
Oh,
how
just
can you
one
not
sperm.
achieve a pregnancy? Hindi ka nangingitlog. So very common. Pwedeng barado yung fallopian tubes mo. Okay? Pwede ring may mga bara dito sa mattress mo or pwedeng mababa yung similya. So hindi makapanik yung similya kasi first of all, ikot lang siya o kakaunti lang siya. O kaya natatapon, no? So pag there has to be meeting of the egg and sperm, otherwise there's no pregnancy.
There's no pregnancy.
So you can't just talk about female infertility. It has to be husband and wife. No?
Yes.
So it's the couple that's trying to achieve a pregnancy.
Now, okay, doctor, let's go to the
To the
abnormalities.
pathology.
Yeah,
So
to the
here,
pathology.
the tube is blocked. So there's no way for the egg to be meeting up with the sperm. Diba? So nagre-release ka nga ng itlog dyan, pero hindi naman mapipick up ng fallopian tube. Okay? Here, you have some myomas. Myomas by themselves may not necessarily cause infertility. Kaya lang, kung malaki halimbawa dito at it's blocking the passage of the sperm or preventing the implantation of the embryo, hindi ka magbubuntis. No? So, merong mga myomas that have to be removed. Meron naman na pwede mong hayaan kasi they will not really interfere with the pregnancy.
Okay.
So, anything that prevents the entry of the sperm, halimbawa, sarado yung cervix dito, o kaya kung may bukol ka dito, kung may bukol ka dyan, yung mga ganyan. So, pwedeng masara yan. But very common would be infection. So pelvic factors constitute about a third of the causes of infertility. So pwedeng magbara ang fallopian tube or pwedeng magbara dito sa where the uterus enters the fallopian tube.
May mga symptoms ba yan, doktora? Like for example, as you said, infection or
Pwede. Pero
meron ba yan?
maraming mga taong walang nararamdaman. So infection usually will present with fever, with a foul vaginal discharge, pain, yan. So those will be...
But this can be treated.
Of course, they have to be treated. No, if you don't treat, then yun na nga, pwede magsara yung fallopian tube. That's where you get the problems. So the moment you suspect that there is an infection, you have to treat that one.
Okay, doctor. As you said, it takes a man and a woman, of course. So hindi lang pwede sabihin mo female infertility lang yung cause that you cannot get pregnant. So there's also the male part of it. So when patients come to you, doctora, do they come as a couple or is it normally? Or just
normally it's a
woman?
couple that comes to us. But there are times, syempre, wala yung husband. Kadalasan sa Philippine situation, yung husband is away. So, halimbawa, OCW siya. So, sabihin, doktora, dadating na ho yung asawa ko eh. So, I want to find out if there's something wrong with me. I want to get pregnant. He's going to be here for 1 or 2 months. And I want to know if I can get pregnant during that time. So, syempre, work up mo siya. Tapos, you prepare her for the coming of her husband. So, strictly speaking, walang infertility doon. Say, like, they're just seeing each other 2 or 3 months in a year. Oh, so,
yes,
like, even if they've been married for 5 years, parang
The
kulang pa rin, di ba?
chances, yeah,
So, no, what we're talking about is, hindi talaga infertile, pero kailangan mo pa rin tulungan. Kasi nga, dapat, ang chance mo magbuntis every month is about 20%.
20%.
20%. So,
And this is during
for
the
normal couples, a woman who's ovulating, whose tubes are okay, at least one tube is working, the uterus is okay, nothing wrong with the pelvis, and the count is good, the male-female component is good, the chance that they will get pregnant every month is 20%. So it's not 100%.
Wow.
Okay, so but yun na nga, so
Labanan pala.
yung husband nandito 1 or 2 months, only 20% every month yung chance. So tutulungan mo na yan. And then you have to correct the factors. Kung hindi nangingitlog, tutulungan mo siya mangitlog, no? Kung meron ding problem with the count, titingnan mo kung ano yung how you can help, no? Is it production? Is it obstruction? So these things you have to take into consideration.
And there are tests to diagnose these things.
Well, you have to, for ovulation, then you check the hormones. Meron tayong progesterone. Progesterone is the hormone that you produce after ovulation. At any one time, there should be 5 nanograms per ml of progesterone. And after ovulation, during mid-cycle, should be about 10 nanograms per ml. So if you're getting that, then that means the patient's ovulating. Now, a woman who is regularly menstruating, has premenstrual symptoms of bloating, breast tenderness, maybe some headaches, mood swings, normally is ovulating. So, kung regular
So, it's a good
ang
thing.
menses mo, chances are you're ovulating. It's not always true, but generally it's true.
Kasi the menstrual period sometimes shifts. Sometimes it comes in every 15th of the month. Or di nag-shift siya or may
Right.
varying
It doesn't
days
have to come on the 15th of the month, but generally you have 28 days, give or take actually mga 7 days, pwede pa 21 days, so 35 days, they say would still be normal.
So yung infertility pala, doktora, as you said, if hindi frequent yung intercourse and within a 1-year period, it's not regular or there are no...
Siyempre,
Siyempre,
kung madalang mag-contact,
Oo,
di ba?
contact.
Oo,
Talagang,
oo.
the the chances, as you said,
Oo.
yun nga kung regular, everything is equal, 20% lang. What
Oo.
more yung lalong,
Correct.
merong mga,
Hindi, tsaka
mga
minsan,
ano,
yung babae, okay naman siya, pero yung mababa, yung similya yung
Ng
husband.
lalaki, yes,
Oh, so
ng
yun. So,
husband.
it takes two. Sometimes the problem lies in both of them. So, both are subfertile. So, yung babae, hindi nangingitlog lagi. Tapos yung lalaki, mababa yung count. Kung if he got married to somebody who's very fertile, pwedeng ma-overcome yung infertility. Pwede pa rin sila magka-baby. Ganon din, yung babae naman na madalang siya mag-ovulate, pero ang ganda ng count ng husband, pwede pa rin magbuntis
Pwede pa
on
rin.
their own.
Parang na-offset,
Oo,
kumbaga.
na-offset. But so generally, it's a combination of factors. And our job is to find out what is the reason why they're not getting pregnant and to help them along the way.
How did you come to specialize, Doctora, in infertility, particularly female fertility?
Kasi I was already in OBGYN. And I wanted to do something higher than OBGYN. And at that time, wala pong masyado sa specialized, no? Yung mga fellowship, ganyan. There's cancer, there's infertility. So medyo, yun lang yung mga choices on. And at that time, when I finished my residency, kakaunti pa lang yung experts sa country sa infertility. And I thought, well, when they get pregnant, it's a happy event. No? Pag nagbuntis, di ba? Yun, and then you're helping them. So everybody's happy. With cancer, of course, we deal with cancer patients, pero nalulungkot ako kasi sa cancer, di ba?
So that's why
Yun.
it's
So
also
parang,
affected.
for me, this was a very happy thing. And then you realize, not everybody can get pregnant, no? So, I mean, you do your best, but there's still some patients who can't get pregnant unless you do special procedures or, well, some procedures they cannot accept, maybe because of religious constraints or even moral issues. So, yun.
Or
So, these
not
are the
up-
things that you have to discuss with them. Ito na yung informed consent process.
And this is why you came to this specialization. As I said,
Yeah,
it's a happy
for me, it's
result.
it's a
when
very
you-
fulfilling field. Oo.
All right, Doctora, we will talk more about female infertility, and joining us is Doctora Attorney Teresita Sanchez and of course Father Jerry Manlangit on the second segment. Stay tuned.
So if I were you, I would be a lot more careful about what comes out of my mouth, especially in such a place where anything can spread like wildfire.
Why when you share something to a public, you find that experience and that experience so rich it could change other people. Okay?
Encouraging their generation about social media.
Like, there are other senses, right? So you hear it, you see it, and then you can smell the fireworks.
Now, would it be okay by asking, you're already practicing
You leave a word to your audience to be allowed. Very
something that I've learned is
Words can inspire and words can destroy. Choose yours. Okay?